Amy, will you share with us a personal experience regarding prescription drug abuse? Something that's touched your life?
Sure. A little more than a year ago, my 20-year-old daughter died from a heroin overdose. And she had been battling an addiction for a few years, which started with a legitimate prescription for hydrocodone. She'd had some back pain that resulted from repeated snowboarding accidents and intense soccer playing, and ended up with a ruptured disc and a herniated disc. And we went to a neurologist, and first he wanted to do surgery, and both of us were not ready for that. So we said, well, is there something else we can do first? And he said, well, we can try physical therapy. Sometimes that will help. And he said, in the meantime, for the pain, I'm going to prescribe some pain medication. And it was hydrocodone. And, at the time, I was thinking, okay, this is a doctor, and he knows best, and let's go with that. And I didn't want my daughter to be in pain, and didn't ask the right questions at the time. And she quickly formed a liking to the medication. And it was probably 3 or 4 weeks into her using the medication when I realized that she was using more than she should. And we ended up discontinuing her refills. But apparently it was too late. She was already hooked and proceeded into using illicit substances. Spent a few years fighting it, and she would be clean for a while, and then she would relapse, and then her final relapse killed her.
Well, I am really sorry to hear about all that.
Thank you.
I really am. Being involved in your local coalition that you are. I know you mentioned earlier that the problem just seems like it's insurmountable. I remember you saying that during the discussion. Why should we address this if it's something that is just insurmountable? What's your opinion on where we should go with that? Like, how should we address that, these issues in West Virginia?
From my perspective in my community, when you would consider it on a broad base, it does seem very insurmountable because there are so many contributing factors.
Sure.
The stigma associated with substance abuse. Maybe not necessarily prescription drug abuse, because people think it's prescribed, it's okay. But quite frequently, the prescription abuse leads to illicit drug abuse, and that becomes a stigma, and people don't want to be involved with it. So there's that, the stigma associated with it. There's inadequate treatment for it, inadequate funding for substance abuse prevention and treatment. Just a huge, overwhelming contributing factors. So I think it's important for people to try and narrow that down some and start at home, start with what they can do. And for me, in my community, I feel like there's a general lack of awareness that it truly is a problem, and families, individuals are battling an addiction every day right in our own community. And I think if we would just start with raising awareness and letting people know this is happening, I think many people would move to the next step of, all right, what can we do about it? And then, hopefully from that there would be a discussion from people who face it every day, whether it's a doctor or an emergency medical technician who is resuscitating someone who's experiencing an overdose, or the schools where a bunch of kids brought in stuff from their medicine cabinet and started talking about, okay, it's not just isolated incidents, it's happening more than we all may realize, and here are some things that we can start doing about it, because the fact is that it's happening.
Yeah,
And
sure is.
and if people are aware, I think they'd be more inclined to take some action.
Mm-hmm.
And even if it's being more diligent in locking up their medication, even if it's being more diligent in really questioning their medical provider. Is there an option? What are the risks of taking this medication? Are there options? Is there something else that's less addictive or might not cause as many problems? I think we're all responsible at some extent, and it may be just as much. It may just be a matter of being informed.
Sure.
And that might be the level of an individual's responsibility. Some people might take on more, but
Sometimes I think, doing the work that I do, how can I get folks to to even flirt with taking that kind of responsibility? Because I think of some of the folks that I engage, conversations with about this topic, and I really wish that more people would ask questions of the doctors that they see, but I think something that you said in the very first part of us talking here, that most people think that the doctor knows everything and needs to, and knows what's best for me and my body. Mm-hmm. And, I think that might be a really interesting campaign to launch, just try to take a little, take more of a personal interest in what
personal responsibility, and people need to realize that physicians are human. Mm-hmm. Certainly they're dealing with a very important aspect of a human life, essentially a human life. They're dealing with their medical condition, so they do have a heightened responsibility. They've selected that responsibility. However, they are human, and quite frequently they're overwhelmed with patient care. And we can probably get into a whole discussion of insurance reimbursement and malpractice and needing to see that many patients to cover all their costs, and that's a whole other issue. But the bottom line is it comes back to patient responsibility. You need to have a certain degree of trust in your medical provider, but that doesn't let you off the hook.
Right.
You need to be informed and ask those questions, and if you don't feel right about something, go see somebody else. I think that's a really important component, and maybe that's what we would hope that most people would do. Maybe not everybody's gonna go tattle on some kid they see going into a known drug dealer's house. Maybe that's just more than they want to do, but they can say, I'm going to take responsibility for my health care and make sure I'm asking the right questions.